Hi, this is Dr. Greg Relo with Express Dentist. Do you look in the mirror and see crooked teeth? Does it bother you? If so, there are options to straighten out those teeth. However, if you see the crooked teeth and you're happy with your smile, then it's not entirely necessary, at least from a cosmetic standpoint. But what about crooked teeth being unhealthy? Is there any way that they could contribute to health? I'm asked this question in the office from time to time, and the answer is yes, they may. Not so much in the short term, but over a longer period of time, crooked teeth may detract from oral health. So, why is this? You could be a little more prone to gum disease and cavities. And the reason is because crooked teeth are generally more difficult to clean. And even when you think you're cleaning them, you may be leaving plaque in areas where it gets trapped. Remember, plaque is that sticky bacterial substance that builds up on our teeth and releases toxins that are acidic, and that irritates the gum tissue. And once the tissue gets irritated, it affects the bone around our teeth, and the bone can be dissolved as a result of this, and it's actually the most common cause of tooth loss. So if we're really struggling to keep crooked teeth clean properly in those nooks and crannies, then it could be sites where gum disease begins. And if there's plaque building up there, it also is an area where cavities could form as well. And that can become a real problem where you get cavities in areas that are very hard to access. They can even be difficult to fix. So these are very real concerns with crooked teeth. And it really depends how susceptible you are to gum disease and cavities. You may be susceptible to both or to one or the other. And even if you're not, and there's bacterial plaque that builds up there, it could contribute to bad breath, and you could struggle to understand why. It could just be a bacterial plaque buildup problem where it's not getting removed. Now, could it extend beyond this? We know that the mouth is the gateway to the body, and gum disease has been implicated and connected to heart disease and stroke. How is that? Bacteria from gum disease can get into the bloodstream and travel very quickly throughout the body. It makes sense. You have gums that are bleeding, so that's an open doorway, and the bacteria get in from the gums, and they're toxic, and so they can travel through and adhere to certain vessels in the body, and as a result, it can damage those areas and cause inflammation. So could we say that crooked teeth could lead to heart disease? Well, it might be a stretch, but it could be indirectly a contributor if you have gum disease that results from crooked teeth or is aggravated by crooked teeth. So there are a number of reasons to consider a better smile, straighter teeth. It starts with how you feel and how confident you are. There's some real health benefits mentally, psychologically, and emotionally. And then it, of course, extends to the physical with the oral health and your ability to keep your mouth healthy. But it could go beyond that and even affect the rest of the body if it's contributing to gum disease that's difficult to control. So no matter what the concern is, if you have crooked teeth and you're interested in finding out what could be done, we do have a trusted network of dentists and orthodontists that we can reach out to. So if you contact us, we can put you in touch with someone that you feel comfortable with and you trust and has been vetted in our network. So keep smiling, stay healthy, and all the best.